are limited to 1 hour. If there are remaining questions in the queue when we conclude, and you feel your question hasn't already been answered, please submit your questions in the chat or by email, and we will work to get you a response in writing. Thank you. Thanks again for joining us. We will begin in just a few moments after we grant recording permissions. Okay, I believe all permissions for recording have been granted. If you requested permissions in the chat, you should now be able to record. If you still need permissions granted, please leave us another message in the chat. Dr. Vanderhoff, we will now hand it over to you to begin today's press conference.
Well, thank you. Good morning, and thank you to everyone for joining us today. I'm Dr. Bruce Vanderhoff, Director of the Ohio Department of Health. Thankfully, we are seeing many signs of improvement in some of Ohio's first and hardest hit areas during this historic and record-shattering surge in COVID-19 cases, a surge which, of course, has been fueled by the highly contagious Omicron variant. Statewide, hospitalizations reached a pandemic high earlier this month and have been slowly declining for the last 10 days. That drop has been the steepest in Northeast Ohio, where hospitalizations have fallen by as much as 24% in the Cleveland area this past week. One of our most frequently asked questions is if we've reached our COVID-19 peak, signaling that an end might be in sight. Certainly, the signs of a downturn that we're seeing in some parts of the state, especially those that have recently been so severely impacted by COVID-19, do bring us renewed hope. But the reality is that many other parts of our state are still on the rise of this Omicron tidal wave. In fact, Ohio is averaging a staggering 22,000 new COVID-19 cases every day. And while overall hospitalizations for COVID-19 are trending downward, just yesterday, we had our second highest day for hospital admissions on record. So, despite some encouraging signs, our hospitals remain strained, and hospitalizations are still rising in southern and western Ohio. In fact, the southwest region of Ohio reported a 14% increase, and the western Ohio region a 13% increase in ICU admissions for patients with COVID-19 compared to last week. And it's not just adults that are impacted. Indeed, Dayton Children's Hospital is treating a record number of children with COVID-19, the vast majority of whom are unvaccinated. Even as COVID-19 is shifting in terms of its surge impact across the state, our supportive resources are also shifting. The Ohio National Guard resources that were supporting testing in Akron and Cleveland are no longer as essential there as testing demand declines in that region, which is allowing the Guard to redirect resources to support new testing locations in other corners of our state. While testing needs have decreased in Cleveland and hospitalizations are trending downward, hospitalizations are still extraordinarily high and still above our previous peak back in December of 2020, when hospitals were facing a crisis even as COVID-19 vaccines were just beginning to arrive. So while there are signs of improvement, The demand for healthcare services is still at an all-time high across the state, and relief is still essential to meeting Ohioans' healthcare needs. Thankfully, the Cleveland Clinic, which is still coping with large numbers of hospitalizations, is now receiving federal assistance from a team of 20 U.S. Air Force medical professionals. This increase in medical staffing benefits not only Cleveland, but the entire region that depends on the Cleveland Clinic for critical life-saving care. And now we have word that FEMA has approved a medical response team for Summa Hospital in Akron. And at this time, we're still awaiting details concerning the makeup of that team. As we shared last week, the Omicron surge has led to soaring demand for COVID-19 at-home rapid tests, and consequently, a shortage in supply. This demand for testing continues to grow nationally and continues to stretch our national supply chain. Now, this month, Ohio ordered 1.2 million proctored testing kits, but only a fraction of those tests have been delivered. Our state is still anxiously awaiting the arrival of another shipment of these home tests to distribute to our community partners. Once that shipment arrives, we anticipate having approximately 400,000 testing kits that we can distribute. Once tests become available and the urgent requests of our schools are filled, the state plans to resume fulfilling requests for these rapid test kits from local health departments and other community partners. Ohio was one of the very first states to widely distribute free rapid testing kits, and we've provided more than 5.6 million free testing kits to date. But as a result of these ongoing supply challenges stemming from extremely high national demand, it's likely that the state's ability to provide tests could be intermittently affected. Now, while testing supply chains are challenged and are impacting our ability to provide free tests to everyone who wants them, tests are still available. Over-the-counter home rapid testing kits can still be purchased at many pharmacies and grocery stores. Testing is also available at many urgent care locations, community health centers, and pop-up testing sites. In addition, the federal government is now offering free at-home rapid COVID-19 tests mailed directly to households. As many as 4 tests per household can be ordered online at covidtests, all one word, .gov. This is an opportunity for Ohioans to order tests to have on hand at home if and when needed. And of course, we continue to expand testing availability statewide with the help of the National Guard. This week, Governor DeWine announced additional testing locations that will receive Guard support to relieve our stressed hospitals and health systems, and to help increase access to testing for every Ohioan. Now, we're joined by Major General Harris with the Ohio National Guard. This week, Governor DeWine announced updates to National Guard support efforts all across the state. Decreasing demand at some of the first testing locations that opened last month has allowed resources to pivot to meet increasing demands in other parts of the state, including Southern Ohio. Now, Major General Harris, can you talk a little bit about some of the most recent deployment updates and how the Guard is prepared to pivot and flex to meet our changing needs?
Yes, thank you, Dr. Vanderhoff. At the start of this operation, Governor DeWine's guidance to me was very clear. He told me 2 things. Number 1, let's get into the hospitals as rapidly as we can to assist with this surge. And the second piece was deploy the Guard to the places where we can have the most impact to relieve the stress on the hospitals. Well, regarding number one, I think we've checked that block. Over 2,000 guardsmen have now responded on literally on days' notice, mostly deployed to the northeastern part of the state. Regarding number two, that's required us to be flexible because the need to relieve stress in the hospitals has changed, as you've stated, to various parts of the state. So we're now in the process through an extensive planning group that's comprised of the Ohio Department of Health and Ohio Hospital Association. We use those projections to look at where we think the stress will be greatest on the hospitals. And as you mentioned, that stress is shifting from the northeastern, the Cleveland, Canton part of the state, and we're seeing the increases now in the southern and the western part of the state. So we try to give the hospitals at least a week notice that we're going to be disengaging from their hospitals as we leave various parts of the state and move to where the need is going to be greatest. So right now we're in the process of disengaging well over 400 of our service members from the Cleveland area and looking at moving to the Dayton, Cincinnati, and the southern part of the state where we see the demand increasing.
Thank you, General Harris. When the Guard deploys to a new site, I know it's not as simple as saying, okay, here's the new site and just walking onto the site. There's work that goes into that deployment. Could you walk us through the process of getting started at a new site for the Guard?
Yes, well, as I mentioned, we try to anticipate at least a week lead time for moving the teams. Number one, so that we give the hospitals adequate planning a time on both ends, but also the logistics, just transporting service members across the state, scheduling lodging for them to the other states. But when they actually show up at the hospital, there's some things that have to be accomplished also. Simple things like badging and access to the hospital. Some of the hospitals do additional testing before they come in, and briefings for simple things like infection control that may be specific to the hospital and the standard procedures that happen in those hospitals. So generally a day of orientation and those things I just talked about as the teams settle in, and then they'll generally go to work on day 2 or 3 once they've completed those. We have found the reception at the hospitals absolutely incredible. And I have to thank you and the other providers on the team, the leaders of these hospitals, because they've received our Guard members with open arms. And quite frankly, it's humbling for these professionals who've been at this for 22 months to be so enthusiastic and so receptive of our National Guard members. So thank you and thank the community for that. But I have to say that our Guardsmen have been incredibly flexible, but the planning teams that anticipate where the Guard's going to go have been pretty accurate so far.
Well, thank you. It's really gratifying to hear that. It's so important given the sacrifices that these Guard members are making in deploying to help our hospitals and health systems. Could you share just a little bit more about what some of their feedback has been about the experiences, what they are telling you about maybe some of the value of those experiences?
Well, first and foremost, the intrinsic value, the feeling of fulfillment that our service members are getting for this operation has generally exceeded their expectations. Many of these people have been called to duty several times before, whether that's as a result of a COVID response or for overseas deployment. So most are pretty seasoned. But to be able to have an impact so close to home in their own communities always has a profound impact on the morale of our troops, and they're feeling that they're making an important contribution on a day-to-day basis, and the impact and the results are immediate. The sense of partnership they have with the staffs already in the hospitals give them immediate feedback that they're doing a very positive thing. But the other piece of feedback I get is that many of these people, most of us, have never seen what makes a hospital work. And it's fascinating for them to be partnered with the hospital staff to make that happen. And I'm getting feedback that some of our members are actually showing interest in going into healthcare profession, the healthcare field now. People who've never really had an interest in that are seeing what makes a hospital work and showing that it's something that they may like to do in the future, or maybe change their civilian professions to do this. So that's just indicative of the reception that they've received and how well they've been integrated into the work that's happening in the hospitals.
Well, thank you very much. Thanks again for your leadership, General, and for the incredible contributions and service of your Guard members. Next, we're joined by Dr. Alice Kim, the Medical Director for Medical Operations at the Cleveland Clinic, who's here today to share an update on hospitalizations and the new federal assistance that they're receiving from the Air Force. As we shared earlier on these press conferences, the Cleveland Clinic asked for this support as hospitalizations were peaking, and the Ohio Department of Health, in coordination with the Ohio Department of Public Safety and the Ohio Emergency Management Agency, worked with the Federal Emergency Management Agency, FEMA, to seek assistance. Dr. Kim, could you share what's been happening at the Cleveland Clinic this week with the arrival of that U.S. Air Force medical team, including some of the roles the team is going to fill, and what the impact of that is for your staff and those who've been working so tirelessly to provide patient care?
Thank you, Dr. Vanderhoff, for letting me have the opportunity to talk about what is happening here at the Cleveland Clinic. I first want to say thank you to Major General Harris and the Ohio National Guard for all they've done for us to support us through this really challenging time. And now very grateful for the U.S. U.S. Air Force team who has come to us to help us at the main campus. So they are going to be providing medical support for our teams here. We're happy to say they arrived safely yesterday. They are undergoing orientation and they should be up on the clinical floors in the next day or so.
Well, thank you. As we mentioned earlier, it appears that the Cleveland area has reached its Omicron peak and that the cases and hospitalizations are beginning to decline. And while that's encouraging, I think it's important for Ohioans to understand just how substantial the spread has been in Cleveland and that the COVID numbers are still extraordinarily high there. Could you reflect on what you and your team have been experiencing through this surge and how this outside support from the Guard and the Air Force is enabling your team to continue delivering vital care, not only for Cleveland, but for the entire region and the state?
Yes, so as you had mentioned before, we are hopeful because of the declining numbers that will actually translate into decreasing hospitalizations and ICU level care. So over the last 10 to 12 days, as you had mentioned, we are seeing about 20 to 25% decrease in the hospitalizations throughout our zone and also our region. But we have to remember that that number is still very high and the highest it has been in the pandemic. So even at the Cleveland Clinic, 10 to 12 days ago, we peaked at about 1,200 patients within our hospital system. Thankfully today, again, it's down to about 700. But again, this has been a very big stress on our system. Our healthcare workers have been working nonstop. So the medical team from the Air Force, which includes a team of physicians, nurses, as well as respiratory therapists, will help support our medical teams here at main campus. And it's really an effort to, again, allow us to give more care to our patients, but also to accept transfers from throughout the region so we can serve the region as a whole. So we are hoping that, again, with their added support, we can, again, serve and take care of patients safely and effectively. The National Guard, again, very grateful for what they have done for us in supporting critical non-clinical roles within our hospitals. And also, as you had mentioned, give access to the community for that mass testing that was really needed in the last few weeks. And as Major General had mentioned, that will be standing down the Walker Center here in the Cleveland area in the coming weekend so that they can be deployed and support other areas within the state.
Dr. Kim, what are some of the important steps that Ohioans can take right now to continue supporting their hospitals and protecting themselves and their loved ones as we continue to encounter a lot of spread of COVID-19 driven by this Omicron variant?
Thank you for letting me have that as a way for us to segue. I think we have to, again, always remember that we are not out of it yet. We are, again, very hopeful with the declining numbers, but our best armor is really getting vaccinated. And it's not only you getting vaccinated, but really helping your loved ones understand the importance of that. Again, when we look at our data, the majority of patients that are hospitalized and in ICU level care, 80 to 90% are unvaccinated. So we really are trying to encourage not only vaccination to prevent hospitalizations, but also continuing to encourage masking and social distancing so that we can all keep our loved ones safe, the public safe, and keep patients out of the hospitals until we have a better control of the virus moving forward.
Thank you so much, Dr. Kim. Next, I'm joined by Dr. Roberto Colon, Chief Medical Officer at Miami Valley Hospital in Dayton. Dr. Colon, could you share with us a little bit about what Dayton is experiencing? While in many cases, Omicron has proven to be less severe compared to past variants, nevertheless, your hospitalizations are extremely high. What patterns are you seeing with COVID-19 patients who are requiring services at your hospital?
Well, thank you, Dr. Vanderhoff. I first of all appreciate the opportunity to be here, and I have to echo Dr. Kim's sentiments for Major General Harris and the Ohio National Guard for their immense support during this operation. Things continue in our Dayton area to be very critical and tremendously stressful. The pace of new cases have really not slowed down like we have yet seen in other areas, and that continues to lead to significant numbers of hospitalizations. It is tremendously taxing to our staff, our physicians, and our nurses. And one of the most telling things that I've heard is from physicians who have had prior military time, who have been deployed in forward locations, comparing this to the situation, and in many cases noting that this is more stressful because the operational tempo doesn't slow down and continues at such a high pace. And I think that is a big thing and a big impact is how long this has been going on and the effect that it has had. We are still seeing the high rates of hospitalizations, but it's not distributed equally among everybody in the community. We are seeing that 83% of the people who are in the hospital for COVID-related illnesses are unvaccinated. So that again stresses how important these vaccines are at keeping people safe and the incredible impact they could have in the resources. Imagine if where we are right now, we only had to contend with less than 20% of the COVID patients that were in the hospital. How different that situation would be. And I think that that's an imagery that we want everybody in the public to remember, because that's how you can be helping right now.
Thank you, Dr. Clone. Well, so how are your hospital, how are hospitals in that Dayton region coping with this surge in cases? What are some of the steps that you and your colleagues have undertaken to ensure that the critical healthcare needs of people are being met even in the face of these very high volumes?
I think the first thing we've been doing is collaborating as a region, and there has really been a lot of communication among the different systems in our facility, including those we serve in the outlying communities, to ensure that we're trying to maximize our impact. But we've had to adjust our operations, and I think that the most outwardly noticeable change, like many other hospitals, we had to reduce the number of elective cases that were going on to recognize that we had to maintain the ability to care for our patients that were continuing to have urgent care needs. We've also had to stretch assignments for everybody, caring for more people and in different locations and in different ways. So the creativity that has come out of this may be a hidden positive that has allowed us to become a little more efficient in how we operate. And hopefully those are things that we can continue sharing with other facilities across our region as well.
Dr. Clone, what has the impact of the Guard been on those efforts to continue serving the people of your region in the face of these demands?
I can only say, wow, it was an incredibly welcome sight having them in our facility, and it's been a tremendous boost for morale, a tremendous help. On the first day when they were touring our facility here at Miami Valley Hospital, and they went through one of the units, everyone in the unit immediately stopped and started clapping. I think that speaks volumes to how welcome they were in our facility and how much they appreciate their presence here. Their focus has been predominantly in non-clinical locations, and it has had a tremendous impact. in picking up some of those staffing challenges, but they've also been able to assist at our outpatient testing locations where we have seen a huge rise in the community need for testing capacity, and they have been able to ensure that we have met that need for everyone in our community.
Thank you. I'm going to segue by asking you the same question I asked Dr. Kim. What would your advice be to Ohioans in your region regarding what they can do to protect themselves, their loved ones, and their community?
I am going to sound like a broken record, but the most important step we can all take is to prevent the disease. Vaccines and boosters, when appropriate, are the most important step we can take. They have a great impact on the severity of illness and the ability for this to continue to spread. Mask wearing cannot be underemphasized. Masks work. They help reduce the chance that we are going to pass it on to one person or acquire it, but they work best when everyone is wearing them. And that's what we continue to encourage, that mask wearing. We've got to make sure that we are continuing to observe that social distancing, and in particularly avoiding any of those large gatherings, especially those indoors when we're coming into contact with a lot of people. Those are just too many opportunities to come into contact with one of the many people who right now have this infection. One of the other things that we want to emphasize is if you're sick, please do not assume that this is just a minor cold. Something that looks like the sniffles can actually be COVID. We want to make sure that if you become ill, you talk to your healthcare provider or that you secure a test to exclude COVID first. And lastly, everybody has continued to talk about how busy our emergency hospitals are. They should not be the primary location to go get a test. If all you need is a test, we are going to encourage you to please seek one of the other many community resources that we have so that we can use that very valuable resource to deliver care to those who need it. Thank you.
Thank you so much, Dr. Klum. Well, Omicron continues to absolutely spread in a very, very impressive way across Ohio, impacting schools, businesses, and everyday life. We simply cannot let our guard down now. Now more than ever, we need to remain vigilant in protecting ourselves, our loved ones, and our communities. Remember, as we've shared, if you're vaccinated, you may still get infected, but you are highly unlikely to experience a severe illness. But if you're not vaccinated, you may be at very real risk for having the more serious outcomes like being in the hospital or worse. More than 90% statewide of those who are hospitalized are in fact not fully vaccinated. Today, more than 7 million Ohioans are in fact fully vaccinated, and more than 3 million are boosted. But millions of Ohioans still are not. If you're not vaccinated, please talk to your healthcare provider and get the facts about the benefits of vaccination. Also, as my guests have shared, please wear a medical grade mask, especially in crowded indoor environments. Layered prevention strategies are simply our best defense after vaccination. And vaccination, along with timely boosters, testing if possible, staying at home if you feel even the least bit sick, as Dr. Colu noted, masking indoors, proper ventilation, and regular hand washing, they can all work together to help limit the spread of COVID-19, as well as other respiratory viruses like the flu and many other winter respiratory illnesses. So if you have cold-like symptoms, but you're not sure if it's COVID-19, please play it safe, isolate yourself, and work to reduce the spread of COVID-19 in our communities. And remember, as my guests have said, even with mild or no symptoms, you could pass the virus along to someone else who could have a much more severe version of illness. So let's stay vigilant. Together, we can work to help reduce the spread of COVID-19. Thank you, and I think we can now open up to media questions.
Thank you, Dr. Vanderhoff. Our first question is from Dan DeRose with WOIO.
Good morning, doctors, and thanks for the time again yet today. Terry Allen, the director of the Cuyahoga County Department of Health, announced yesterday that Cuyahoga County peaked January 1st and that the numbers are declining as quickly as they went up. It was a short time later, I interviewed Dr. Claudia Hoyen with University Hospital, Rainbow Babies and Children's Hospital, and she said, to quote, "It is a huge sigh of relief." Now, we know it's not over. We know that the Southern Ohio is dealing with what we went through a couple of weeks ago. But Dr. Bruce Vanderhoff and perhaps Dr. Kim, do you share in that sentiment? I mean, for a couple of weeks, the record setting, I mean, are you breathing just a touch easier? What is your personal opinion and how do you feel today?
Yeah, thank you for that question. Great question. I think it's very much on point. I'll begin by saying that we are seeing improvement in the numbers to the north, as I shared. And I think that is a encouraging sign for us as medical leaders contending with dealing with the Omicron-driven COVID-19 surge. But having said that, a couple of things that I think we do need to bear in mind. First, hospitalizations do tend to trail a little bit behind case numbers. So those improving case numbers, of course, are a very encouraging sign to us. But the reality is we still have a lot of people in our hospitals with COVID-19. And despite the improvement in those numbers, the fact that we are still hitting north of 20,000 positive COVID tests every single day in this state tells us that we're still dealing with extraordinarily high numbers. So what I would not want people to do is breathe such a sigh of relief that they think that this is entirely over. We're still in the midst of dealing with this surge, and we have to continue to take the important steps that we need to protect ourselves and our communities. And one last thing before I turn to Dr. Kim that I'd add is we also have to remember that COVID-19 is not going away. COVID-19 will be a part of our healthcare landscape for the foreseeable future, which really underlines the importance of considering vaccination if you've not yet been vaccinated. Vaccines have clearly shown themselves to be the safest way to assure yourself that you have protection from severe illness. And so that's one point of encouragement I want to make sure to underline. Dr. Kim, what can you add to my comments?
I echo your sentiments, Dr. Vanderhoff. I think we are all hopeful, but we want to take some caution with that enthusiasm. So we all know that this is our sixth surge, actually, and we just cannot be complacent. We're not out of the thick yet. Again, we still have record high numbers, although there is a decline noted. So again, just reiterating what my colleagues are saying, we are hopeful that this is a sign that things are headed the right direction, but don't want to get too complacent with the other safety measures and, of course, vaccinations that we all are encouraging so we can get to that hopeful point.
Our next question is from Candace Price with WHIO.
Good morning.
Good morning, everyone. Thank you all for doing this. I really appreciate it as well. So Dr. Vanderhoff, you were just saying that this isn't the end for us. So we're already hearing scientists talk about the next variants, and we've been talking about vaccination. So how sure are we that vaccination can protect us against new variants? And how much of our community do we really need to see vaccinated to actually protect us from future surges like we're seeing now?
Well, thank you for that question. I'll begin and then turn to some of my physician colleagues to see if they have additional thoughts. But first, I think that the lesson that is hopefully coming home to us is we have seen variant after variant impact Ohio and our communities and families, is that vaccines do a very good job at preparing our immune systems to protect us from the worst outcomes of COVID-19. They've shown a remarkable durability, and that is probably driven primarily by what is known as cellular immunity, by the preparation that our B and T immune cells get as a result of vaccination to be poised and ready to protect us from those most severe outcomes of the virus. So I think we're encouraged that vaccination has proven its worth, and that as we look ahead and have to anticipate that there are going to be other variants of this virus, I think that the proof has been in the pudding, and that is vaccines have worked. Vaccines continue to work to protect us in the way they were designed to protect us, and that is against the severe outcomes of illness, not necessarily from getting some degree of mild to moderate illness, but protecting us from getting really sick. So that would be my first point. The second is that we have been encouraged by the fact that Omicron, I think, does represent an evolution of the virus in the direction that scientists anticipated that evolution would occur, which is towards a form of the virus that, while more contagious, does appear to, on a per capita basis or an individual basis, create less of a risk to the individual of that severe illness. Nevertheless, we've also seen that that's no guarantee that any given individual is not going to get sick. And we've certainly seen that play out in our hospitals. Let me turn to my colleagues and see what else they might offer regarding this.
Thanks, Dr. Vanderhoff. The only thing I would add is it's often asked, what can we do right now to help prevent some of those? And adding to the immunity right now, reducing the opportunity for this virus to go to other people and potentially generate a new variant can actually help reduce the onset of a new variant in the near future. So that right now is what we can do to help prevent some additional variants from emerging right now that could turn the course. So it goes back to what we were advocating. Vaccinations and masks are incredibly important right now.
Our next question is from Madeline Ottilie with WCPO.
Hi, thank you all so much for taking the time to answer these questions today. We're starting to see some of our local areas near the Cincinnati area take new action to combat the spread. Oxford, Ohio just re-implemented a city mask mandate for indoor public spaces just this week. Obviously, cases here have been spiking for several weeks. This county, we've actually seen some of the case numbers come down. Would you say these moves are coming in too late, or are they still effective and relevant in helping continue these trends and push cases down?
Well, thanks for that question. You know, what we have advocated throughout, what we've continued to recommend is that Ohioans use all the tools at their disposal to help protect themselves and their communities. And that's why we've talked about the importance of a layered approach to dealing with COVID-19, and especially this highly contagious Omicron variant. Clearly, and we've emphasized this over and over, the foundation of that protection begins with our vaccines, which again do a remarkably good job at priming our immune systems to offer us a very strong layer of protection. Added to that, though, are the many other tools that we have advocated throughout. Masking does appear to work. It appears to have a real impact, as do other steps that we can take, being mindful of ventilation in the spaces that we're in, avoiding crowds when we can, frequent hand washing so that we're not inadvertently moving virus around, and a whole variety of other common sense steps that we can take. Dr. Colu, this is a question really in reference to your region of the state. What would you add to that?
I think it's very hard to say that things come too late. We have had to, by virtue of this virus, react to when the virus is active and not active. I think this was simply a move to recognize continuing evidence that the masks do work and trying to help everybody feel comfortable wearing it. There are some feelings of people getting pressure to either wear or not wear a mask. And in some locations, some of these rules can help reduce some of that anxiety and some of that feeling that people get. But that does not take away from the message that every one of us should be taking all of those steps that Dr. Vanderhoff outlined, because they all work in concert together to reduce the risk for infection.
Our next question is from Laura Hancock with the Plain Dealer and Cleveland.com.
Hello. I was just wondering, I mean, you say it appears that Northeast Ohio and the Cleveland area has peaked with this Omicron, but cases and hospitalizations are still pretty high. At what level are you comfortable saying we are out of the Omicron surge? What metric are you watching?
Well, thank you for that question. I can tell you from a state perspective, what's really the most important for us as we're looking at the impact of this virus are measures like the number of hospitalizations that we're having to contend with. We, of course, are watching the total case counts, but those case count numbers are more or less a directional indicator for us. Whereas when we look at hospitalizations and deaths, those represent very important indicators of how severely our health system is being challenged and how much severe illness is impacting our communities and people all across the state. So I would say our focus is really primarily on those. Clearly, as we look at those numbers, we are still very much in the thick of it, even though as we look at the case counts, there's some encouraging indicators that we are headed in a more favorable direction.
Are you saying 1,200 hospitalizations a day? Are you saying, what is the number where, people can kind of sigh a relief?
Well, I'll tell you this, if you look at our numbers now, even though we have seen improvement up in northeastern Ohio, we're still looking at numbers that are north of what we saw during our peak surge back in 2020. So we're still looking at extraordinarily high numbers. We have a long way to go. I think we'll know that we're getting there when we see trends that are pointing in sharply downward directions and doing so in a sustained manner. So I think it's we're well premature of being able to say, breathe a sigh of relief, we're out of the woods. Dr. Kim, you are leading clinical efforts in that very region. What's some of your perspective on this?
Yeah, thanks, Dr. Vanderhoff. I agree. I think it's hard to put a number on it because we have to learn that it's not only the volume of the COVID patients, there's other non-COVID related, patients that need care that we have to also accommodate for. And I think one of the things that we also have to be considerate is there's been a lot of staff shortages. So we have to look at the cases and what we can, take care of as hospital, not only our hospital system, but the hospital systems all throughout, because we are all in it together. And how can we safely take care of these patients? So again, the downward trend overall is there. Agree with Dr. Vanderhoff. I mean, we're still at a peak level that we, way beyond what we had initially and early in the pandemic. So hard because the dynamics are very different these days, again, because it's not only the cases that have skyrocketed, but also the staffing shortages that have really strained the systems. So I think if we have continued downward trend, I don't think it's completely based on case numbers alone, but really how do we, again, have the staffing to make sure that we are safely taking care of any patient, regardless if they have COVID or not.
Our next question is from Joe Ingles with Ohio Public Radio and Television.
Thank you, doctors, for doing this. I want to ask about these numbers that are on the website, on the dashboard. ODH has to continually, there's been spurts, different times during this pandemic where you've had a backlog of numbers and they haven't been put in right away. And it makes it very hard to determine immediately what is happening. It kind of skews the whole process. Why is ODH continually having problems getting these numbers in there correctly?
Yeah, thank you for that question. So the answer is, as we have gone through this pandemic, throughout the pandemic, we have hit numbers of cases that have absolutely exceeded anything that anyone had really, I think, ever encountered before or possibly even imagined. So most recently, what we encountered, and by the way, other states encountered this as well, if you look at the national CDC reporting that's publicly posted, is numbers that were actually in excess of what our electronic systems could process, whether at the state level or even from the reporting level from some testing sites from across the state. So what we did was work very aggressively to augment those systems and to do some rapid, both human and technological efforts to expand their capabilities in new ways. And those were deployed very rapidly and allowed us to catch up very quickly, really within the span of about a week. But the thing to bear in mind is the only numbers that were affected were the total case counts. Certainly the case counts for each day when they were finalized were accurate for that day. But the total case counts that we offered essentially were above 20,000 cases per day. Once we're at that level, especially recognizing that there are cases that, and we've talked about this, that weren't even reported into the system. Once you're above 20,000 cases a day, we're at a level where the transmission is just ubiquitous. The transmission of the virus is happening at an unprecedented level. And that's really all we need to know at that point from a medical or an epidemiologic point of view. So while it's nice from a collecting the facts and looking in the rearview mirror to know the exact number, frankly, it was not something that really had any impact whatsoever on our ability to understand what was happening or what responses needed to occur. When you're at astronomical levels of spread, you're at astronomical levels of spread. And a few thousand cases are not going to change that calculus. Throughout, however, the most important numbers like the number of people who were being admitted to our hospitals, to our ICUs, being on ventilators, those numbers have remained accurate and up to date. And that's really required extraordinary effort, both on the part of our hospital partners and our state data collecting system. So I'm not sure I would agree with your characterization.
Our next question is from Todd Dykes with WLWT.
Good morning, everyone. Near afternoon. Appreciate y'all doing this as always. Question for you from Cincinnati, because I think there's a lot of anxiety. This Cleveland wave is heading our way. We're in it, whatever that looks like. Many medical providers wonder about the oral treatments, Paxlovid from Pfizer, I believe, and the Merck treatment as well. They're reaching out to us saying, where is it? Who has it? There's no coordination as that there's a limited supply. So Dr. Vanderhoff and whoever else would like to weigh in, what's that flow of supply looking like? When can they expect more? What message do you have for medical folks here in Greater Cincinnati on that front?
Yeah, thank you. Another great question. The availability of the therapeutics has been extremely limited on a national level. So Ohio is provided an allocation that's based on a federal formula that impacts every state. And then it falls to us to work with our healthcare providers to assure as balanced a distribution across the state as possible. And so we actually work with healthcare providers across the state in achieving that balance. But the supply has been very, very limited, especially in the face of the sheer numbers. Now, a couple of things to bear in mind there. Omicron changed the game fairly abruptly and dramatically as it related to one form of treatment, which were the monoclonal antibodies. prior to Omicron, we had quite a number of monoclonal antibodies that were effective in treating patients with COVID-19. With the advent of Omicron, it really dropped to one, sotrovimab, which is effective for the treatment, and that's been available in very, very limited supply. The other two therapeutic agents which are effective for the treatment of COVID-19 include the Pfizer product Paxlovid, as well as the Merck product Molnupiravir. Those agents are also available in extremely limited supply, though over the course of the past week or so, we did see some substantial increase in those agents in terms of our allocation. So it is not the situation that we would prefer to be dealing with, but it's a national issue, and we are working with our clinical partners to assure the best delivery that we can to those who are at the greatest risk of having severe outcomes. So the very, very sickest Ohioans being targeted for getting these very limited available treatments. I will conclude by saying that we continue to advocate very strongly with our national partners around the importance of getting more and more of these agents as quickly as possible. And we remain hopeful that in the coming weeks, that pipeline will open.
Our next question is from Sara Shookman with WKYC.
Good morning. I was looking for any more details you may have about SUMA's application to FEMA. I know you said that was just approved and new details still coming in, but if you could elaborate on what was requested, what kind of help was thought to be helpful. I know it's a process, as you had explained with the clinic. And also for Dr. Kim, with the decline in hospitalizations in Cleveland, will those Air Force teams allow Cleveland Clinic to reinstitute elective procedures or make any other changes?
So thank you for that question. I'll begin regarding the SUMA question. As I noted, we really don't have any details. We're delighted to learn from FEMA that we are going to be receiving resources targeted to the SUMA health system, SUMA hospital in Akron, but we really don't have any additional details at this time. As those emerge, we will, of course, share them more broadly. Dr. Kim?
Regarding the Air Force personnel here, again, they are supporting our medical staff here on multiple different units. Our surgical operations team and our medical operations team are in daily conversations on the sort of the reactivation of full surgical operations. So our personnel support from Air Force should not be impacting that decision. We are looking at that on the local as well as enterprise level every day to see when we can again go to full operational force for the surgical cases.
Our next question is from Danny Eldredge with Hannah News Service.
Hello, everyone. Thank you for taking the time to take our questions. My question is actually for General Harris, if he's still on. So New Mexico is having its Guard members substitute as teachers to deal with their teacher shortages. Is Ohio considering doing something like that?
I saw just this morning that New Mexico had instituted that. We have had no conversation about that here in Ohio. We've had no request for that so far, but I will consult with Governor DeWine and his staff should we get such a request.
Our next question is from Jim Provance with The Blade.
Hello again, Dr. Vanderhoff. We haven't heard any mention today of Delta, and we know that was already surging before Omicron came along. Do we know whether or not Delta is still waiting but has been hidden by Omicron?
Well, thanks for that question. What we can factually say is that Omicron has outcompeted Delta nationally and here in Ohio, and done so very, very quickly. What the long-term will look like is really not possible for us to answer. We can look at the past and note that when a more aggressive variant has appeared and outcompeted other variants, it has pushed them to the corner and kept them there. Will that occur with Omicron vis-a-vis Delta? We don't know. Certainly history points in that direction, but it is something I think we'll have to wait and see. I've got two clinical colleagues on. I don't know if they have any additional thoughts or perspective to share there.
I would, Dr. Vanderhoff, completely agree with that. The interesting thing about the Omicron is how quickly it spread. Here in Ohio, it was less than 1% at the beginning of December. And by the beginning of January, it was already accounting for 3/4 of the cases. And by now, we are likely approaching the national average, which is over 98% of the cases. And what happens when that overwhelms is the other virus essentially gets extinguished because it isn't replicating. We just don't see it in a significant amount of numbers. Again, to reduce the chances of any of the variants emerging, what we have to do is reduce the opportunity for the virus to be passed on from one person to the other, which goes back to masks and vaccines.
Our final question for today is from Titus Wu, the Columbus Dispatch.
Hi, thanks for doing this. This is more a question for General Harris. I know you said that right now you guys are in the process of moving 400 units from the Northeast Ohio to Dayton, Cincinnati area. I'm just curious, what's the current breakdown of, by region of, where these National Guard units are. And I'm also curious if there's been any improvement in the kind of the COVID-19 vaccination rate for the Ohio Army National Guard.
Yes, let me answer the second question first. There has been an improvement. Last time we talked, I mentioned that the Army Guard had gone from 53% up to 56%. That's now up to 58%, with another 10 or 11% that have completed their first doses. And the Air National Guard's well over 90%, 92%, in fact, and that number continues to slowly increase. So back to the first question, I don't have the specific array right now of how the forces are laid out in the north, central, and southern part of the state. Most of them continue to be in the northern part of the state, but that'll change here just in the next few days as we move those over 400 forces. I can certainly get you the answer to that information